Hari Om. Welcome everyone to the 25th episode of Sanskriti and Samskar. I'm your host Vishal Wadhwani. Today our topic is yogic and natural therapy. A very interesting topic which the entire world is looking upon to this topic for for well-being. So today I would like to welcome our speaker, Dr. Dhyaneshwari. Please welcome Dr. Dhyaneshwari.
Hello, namaste everyone.
Namaste,
I'm Dr.
welcome,
Dhaneshwari.
Dhaneshwari. Yeah, we are
Thank
happy
you, thank you,
to have you and thank you for taking your valuable time out and
thank you.
coming for this show. So I'll introduce Dr. Dhaneshwari. Her degree is BNYS, which is Bachelor of Naturopathy and Yoga Sciences, which she has done from SDM College, Karnataka. And she is dedicated in promoting lifestyle and modification through principles of yoga and naturotherapy. So today we will deep dive. Today we'll deep dive in a few subjects, very interesting subjects like diabetes, obesity, PCOD, and other issues. And let's start the show. And this show is going to be very valuable for all the viewers around the globe because it's about well-being and without medicine help. So I would like Dada Dayal Harjani to come and please welcome Dada Dayal.
Welcome to all. Jai Shri Krishna, Jai Shri Ram. And a warm welcome to our guest speaker, Dhaneshwari. हृदय से
Yes,
आपको
thank you so much.
स्वागतम अपने शो पर.
धन्यवाद.
Since the show is going to be very interesting, I'll come straight to the point. So today I'd like to start with obesity. Now,
Okay.
according to our little survey that we have done, in America, we have nearly 42.4% obese people. And the obesity rate among children is also reaching about 19.7% in adolescents between age 2 to 19. Then further we studied that in European countries, like in Malta, the obesity rate is 29.7%. United Kingdom is 28%. Hungary is 26.4%. The other countries are less. So that is, okay for them. But for these few countries in Europe, it's quite a endemic thing. And again in India, I find that we have 70% overweight people and 12% are obese. So the overweight people are a precursor to become obese. So I would like
Absolutely.
you to explain to us what is the difference between overweight and obese, and
Okay. So,
how,
yes.
and then later on we'll have a dialogue one by one. So please go ahead
Okay.
and explain to all of us this situation.
Okay. So first, let's see the definition of obesity or overweight. So excessive fat accumulation or accumulation of adipose tissue, which is fat. So excessive fat accumulation is obesity. Mainly, it is caused due to imbalance between energy intake and energy expenditure, or calorie intake and calorie expenditure. So, what are the causes we will see first? There are metabolic factors. So, low metabolism can be one of the cause of obesity. Genetic factors are involved. Low physical activities. So nowadays, people are having sedentary lifestyle. That is one of the cause for obesity. Then hormonal imbalance in case of hypothyroidism, PCOD, PCOS. This hormonal imbalance conditions also lead to obesity. So socioeconomic status, high economic status is having more sedentary lifestyle. So that is one of the cause for obesity. Dietary habits, high fat intake, high calorie intake also causes obesity. Then smoking, alcohol, pregnancy or menopause related condition or psychological factor. Also, high stress levels are responsible for obesity. So, how to calculate our obesity grade? So, there is a method called body mass index. So, we have to calculate our weight and height in that formula, kg per meter square. That is the formula. In that formula, we have to keep our weight in kg and height in centimeters. So, we can calculate our BMI accordingly. If your BMI is within 25 to 29.9 kg per meter square, that is called as overweight. If it's above 30 and between 30 to 34.9, it is called as obesity grade 1. 35.35 to 39.9, it is called as obesity grade 2. And above 40 kg per meter square, it is obesity grade 3, or we can call it as morbid obesity. So we can calculate our BMI and we can manage our obesity or go for dietary restriction, calorie restriction, and exercise management accordingly. So, what are the signs or what are the risk factors which can be developed due to obesity? Let's see that. So, sleep apnea can be developed, depression or cardiovascular diseases like hypertension, high BP. Then, pregnancy-related hypertension can be developed due to obesity. So, fatty liver, diabetes,
You mentioned you mentioned three
right?
grades of obesity. So when
Obesity,
you're telling us the cause of symptoms that you just mentioned, what
right?
grade are you identifying? Are you identifying any one, two, or third grade towards your symptoms, or what? You follow my
No, no.
question?
Symptoms are common. Symptoms are quite common. It's depend on individual's body. We can't grade that in which grade of obesity you can develop which symptom, but
Hmm.
it's depend on individual's body.
Hmm. I see.
Okay, so yes,
Okay. So
so
what are
obesity
the
can lead to diabetes.
hmm.
Yes,
Obesity leads to diabetes,
right.
and what are the diseases it leads to?
Various risks I have mentioned as per like cardiovascular diseases, mainly high BP can be developed. Fatty liver can be developed because of excessive fat accumulation in liver. Then diabetes. So insulin resistance will be more in case of obesity. That will lead to diabetes mellitus. Varicose veins, the edema. So excessive water accumulation in our lower limbs or legs, it will lead to edema. Varicosity also can be lead. Then joint pain. So multiple joint pain. Our joints are made for normal body weight to bear normal body weight. Mainly knee joint, hip joint. Those in case of hyper obesity or overweight, those joints can't bear excessive weight. So it will lead to joint pain.
I'm off.
So we will see about the management through naturopathy and yoga. So first therapy I will be mentioning is fasting therapy.
Echo in
Fasting
your
therapy
voice.
is not,
There's a little
yes.
echo, and
Hello,
can you make it slow? Your speed?
hello.
Yeah. Can you go easy?
Now is it okay?
Explain it slowly.
Yeah, sure. Now is it okay?
Yeah. Go ahead.
So yeah, we will see about management part. So first therapy is fasting therapy. Fasting, there are multiple types of fasting. First, we will see intermittent fasting. So there will be 12 or 16 hours of fasting between two meals. So there will be gap for 8 hours or 12 hours. Within that period, we can consume low calorie diet, and remaining 12 hours or 16 hours, we can go for complete fasting, which is complete abstinence of food. So it will help to detoxify our body. So when we are not giving any calories to our body, or we are not giving any kind of energy or sugar, so body will try to break down our stored fats.
Okay, I have a question. When
Yes.
you're talking about intermittent fasting, you
Yes.
are mentioning 12 hours or 16 hours. What do you recommend?
So there are a combination 8 and 16 hours of combination and 12 to 12 hours of combination. So 12 hours we can go for food intake, 12 hours of
Hmm.
fasting. Another one is 8 hour of window for food and 16 hours of fasting.
So many people have a habit of drinking tea in the morning when they get up, and
Right.
then they don't eat breakfast, and they go and eat dinner, I mean lunch straight away. So would you
Right.
consider that as part of intermittent fasting, or you
No.
you don't consider this as fasting?
No, no. Tea is not completely contraindicated, or we have to avoid tea because again we are taking calories from the tea, and it is stimulating. It gives stimulating effect. So instead of tea, we can go for ashgar juice or any fruit juices, which will detoxify our body.
So you recommend that when you get up in the morning, and instead of having tea, we have juice, and then
Yes,
we
right.
go straight for lunch at one
Lunch.
o'clock or 12:30 or whatever. Is that what you're
Yes,
recommending?
yes,
So
yes,
ashwagandha juice is the best, is it?
yes. Ashgar juice will help to detoxify. So that is one of the best juice we will recommend for detoxification.
Any other? Uh,
Any
any
other
other?
fruit juices is fine. Any
Which one?
seasonal fruit juices will be helpful. Pomegranate juice you can take. Again, depend
Hmm.
on the condition. If you are doing for diabetes or hypertension, so few juices can be avoided if you are having allergies to some food. So that can be avoided. Otherwise, any kind of seasonal fruit is fine.
Okay, so your first remedy is fasting, right?
Right.
You're
Right.
recommending fasting. Okay, go ahead.
Yes.
Okay, go ahead.
Yes. So while we are doing fasting, we have to take a lot of water. So whatever toxins or excessive acids are produced in our body, that will dilute and it will be excreted from the body. So excessive lot of water intake is necessary. Then intermittent fasting can be done twice or once in a week. So that will be helpful. Second type of fasting is juice fasting. So whole day we have to consume only juice. Any kind of fruit juice or vegetable juice can be taken. A combination you can take. Otherwise, you can go for mono juice fasting. Only one kind of juice you have to take throughout the day. So that can be helpful in juice fasting. In juice fasting, also same benefits are there. Detoxification will be happening and you are giving rest to your digestive system, so digestive system will that blood circulation will be diverted towards other systems and that will help to heal your body by itself. So that is one thing. Next, we will see about functional food. So, what are the food which we have to include in our diet, regular diet, which will help to control our obesity or overweight? So, we can include our probiotics during everyday meals, in the sense curd, buttermilk, or fermented food. So, probiotics will help to increase our um, gut microbiota, good microbiota, so that will help to regulate our metabolism. Also, there is a connection between your gut and brain. So, if your gut is healthy, it will help to manage your mood swings, or if you are having any psychological condition like depression, stress, or anxiety, it will be controlled if you are having healthy gut. So, probiotics are very important to include in our diet. So, next is prebiotics. Yes,
1 minute. Let's talk about
yes.
probiotics. Can you explain
Okay.
us more about probiotics? What
Probiotics
are the
is nothing
natural
but
probiotics? What are the artificial, or which we can buy from the market? Can you
yes.
discuss about that?
Sure, sure. So I'm talking about natural probiotics. You can go for supplements, but with the prescription or with doctor's guidance. But for normal people, you can go for natural probiotics, which are present in fermented food like idli, dosa, normal Indian food, or curd, buttermilk you can take, or cabbage juice, nolkol juice you can take. It is rich in good microbacteria. So probiotics is nothing but good microbacteria. So it will help in proper digestion. So gut health will be regulated through that. And prebiotics is one of the other factor. So prebiotics is nothing but fiber-rich food which will help to increase the good microbiota. So that is prebiotics. So we can include both of them in our regular diet.
1 minute. I'm getting confused. There's a prebiotics and probiotics.
Yes,
Did you?
there are two things. Probiotics are real gut microbiota or real microbiota which will be introduced externally. So we are taking good bacteria through our food. That is probiotics. And prebiotics means fiber-rich food like vegetables and fruits. That food will help to improve the microbiota inside our gut.
So what kind of food is that prebiotic?
Prebiotics is nothing but any kind of vegetables or fruits which are rich in fiber or garlic we can take, for example, spinach, any fiber-rich food like watermelon, any kind of food.
What about chapati and all these things? Are they? You
No,
could have
those doesn't
them
come
by
under.
prebiotic.
Uh, no, it has fiber in, but not in much quantity.
Hmm, I see.
So grains have less amount of fiber in it. So fiber rich means which has increased higher level of fibers, which is available in fruits and vegetables.
Okay. So one is fasting, second is prebiotic and probiotic.
Pre- Probiotics, right?
Okay. Okay, go
There
ahead.
are some foods, right? Omega-3 fatty acids we can include in our diet, which is omega-3 fatty acids means good fat in simple language, which is present in flax seeds, chia seeds, and walnuts. So this is flax seeds or chia seeds is high in fiber also, so it acts as prebiotic also, and omega-3 fatty acids, which is good fat that is necessary for reducing your bad fat, that is also present in omega-3 fatty acid or flax seeds and chia seeds, and it is anti-inflammatory in nature. So vitamin C rich food also we have to include in our diet. So amla, guava, orange, this kind of food also we can include, which is anti-inflammatory in nature. And there are some detox juices like barley water, ashgard juices. So it will help to remove your all the toxins from our body. So it is helpful in detoxification. Early in the morning, we can take ashgard juice or barley water for detoxification. Also, low calorie diet and high fiber diet is necessary for managing your obesity or overweight. Uh,
Okay.
so let's switch to yoga therapy. How yoga therapy is going to help in managing overweight or obesity. So we can present slides here.
Okay.
So I have right. First, next slide we can see about Surya Namaskara. So sun salutation or Surya Namaskara is very important practice for obesity. So sun salutation, there is a series of 12 asanas in Surya Namaskara which will help to improve our metabolism, body flexibility will be improved, excessive fat will be reduced, then digestion will be improved. So there are multiple benefits of Surya Namaskara or sun salutation, and it is very important practice if we are focusing on diabetes or obesity or overweight. So we
On a
can
hu-
practice at
on a
least 12
humorous
rounds.
on a humorous note, if you see the sun salutation exercises, all are being done by thin people. None of them are fat. None of them are overweight. So my question is, I respect this, I know this,
Right.
but we have to. Can you suggest some practical exercises for really obese people who cannot make these exercises?
Actually, during exercise, achieving the final posture is not that important in first stage. So
Hmm.
you are doing that posture also. If you are doing forward bending, if you are
Hmm.
obese also, there will be compression of your abdomen. There will be pressure developed on abdomen. So that
Oh,
is going to give same effect as if thin people is practicing same posture. It's going to give same benefit for both of them. So
okay.
here the focus is not achieving final posture, but the trying to do that posture.
Hmm. Okay.
So yes.
Understood.
So right. And also these practices will help to balance your sympathetic and parasympathetic nervous system. So there are two types of in autonomic nervous system. There are two types, sympathetic and parasympathetic. So for balancing our whole body or homeostasis, we are this Surya Namaskara will help to balance both the systems, and it will help to reduce our stress levels. So after following Surya Namaskara, we have to practice deep relaxation technique or Shavasana, any breathing techniques to calm down our mind and to relax the physical or our body and mind. So that will help to reduce our stress levels and it will calm down our body. So that is helpful.
One question.
Next, yes.
What is the relationship between the autonomic system and
Hmm.
obesity or overweight? You say it
Okay.
has to be balanced, the sympathetic and
Yes.
parasympathetic. So,
Right.
can you elaborate a little bit on that?
Yes. Sure. So there are few factors like in stressful condition, our sympathetic uh, nervous system will be more activated. So if there is imbalance between sympathetic and parasympathetic, so sympathetic is responsible for your stressfulness in stressful condition, anxiety, depression condition. Sympathetic will be more active. Parasympathetic will be more active in your calm state or relaxed state. So balancing both are important for maintaining our normal homeostasis, normal body function. But in the balance, there should not be any one system should not be dominating. So balancing that is important to maintain our normal regular body function.
Okay, thanks. Okay, so go
So
ahead.
next we will see some hydrotherapy treatment. So we are going to use water for treatment purpose. Back first slide, second slide we can see gastrohepatic pack.
Hmm.
Yes, so this treatment is very simple treatment for if you see it's very simple treatment, but it has very good benefits for obesity or all digestive disorders. So first, gastropathic pack means hot bag application on your abdomen and cold bag for your backside. So and you have to wrap it with cotton clothes and upon that again you have to wrap it with woolen clothes. So temperature will be stored and it will be uh, it won't change throughout the practice. So this practice should be done for 20 minutes. So this will help to stimulate your digestive system. Metabolism will be improved due to thermal receptors. So different temperature has different benefits in our body. Due to hot temperature application, our blood vessels will be dilated. So it improves the blood circulation in that particular area. So it will help to improve the digestive system, metabolism, and blood circulation throughout that particular area. So that is one of the good practice for obesity or overweight condition. Next, we can see next slide.
Hmm.
So full mud application. Full mud application again. I have mentioned about parasympathetic nervous system. So in stressful condition, anxiety, this mud therapy will help to calm down our mind, and it will help to increase the parasympathetic dominance, which will help to reduce the stress levels. Also, it has detoxification properties, so we can apply mud directly on our body for at least 10 minutes.
What kind
Next
of
slide,
mud?
we can see.
Special kind of mud or what?
So again, no, we have to see. There are different kinds of mud. So it should not be contaminated. It should not. It should be away from all the chemicals or harmful things. So there are multiple criteria to select the mud also.
Okay.
Yeah. Next slide, we can see. We can go for if you're it's not possible to take full mud bath, we can go for mud application to particular area like abdominal mud pack or eye mud pack. Again, I have mentioned it improves the blood circulation in that local area. So applying mud on abdomen also improves the metabolism and your digestive system. Blood circulation will be improved. And applying mud on eyes, it will reduce the stress levels and it will give calming effect. So that is beneficial. Next slide we can see. Okay.
That's,
So
what is
let's
this?
talk about
This
more.
obesity?
Sorry.
Is this for obesity or what?
No, no. We can shut down the slides.
No, I will. We will talk about diabetes later on. So are we through with
Yes, yes. First,
obesity?
let's finish the obesity.
So are you through with obesity?
No, no.
Are you
I will
sure?
talk more.
Yes, you want to say?
There are few more therapies like cold. Uh, Hello. Oh, okay. So there
Yeah.
are few more therapies like full body massage. Body massage will also help to improve the blood circulation throughout the body. Metabolism will be improved, and it will also calm down your body and mind and gives relaxing effect. So once in a while, once in a month, we can go for full body massage, and fat mobilization will be improved due to massage. So that is also very beneficial for obesity condition.
So
Yes. So that's it about obesity.
so
Any question is there?
before we finish obesity, what about the diet factor?
I have mentioned earlier the low calorie food should be taken, high fiber intake should be done, omega 3 fatty acids, probiotics, and prebiotics should be included in our diet. So, these are dietary factors should be considered during obesity or overweight management.
Okay. So now we'll
Yes,
go into diabetes, and I'll let
yes,
Vishal ask you some questions on diabetes. Now, diabetes also is very prevalent in India. We have
right,
nearly 12% the people who are diabetic in India, which relates to 77 million adults. So this is quite a significant problem. And also, I've heard that China has got a high diabetes burden with an adult prevalence of 10.9, and many Middle East countries have adult diabetes between 10 and 15, and Egypt and Saudi Arabia have between 15 and 16%, which is more than India. So go ahead, Vishal.
Yeah, sure, sure. Thank you.
Continue.
So yeah, the obesity part was very well covered by you. Thank you, doctor, so much. And multiple times you said that obesity is linked with diabetes and other
right,
illnesses, types of illnesses. So when we talk
right,
specifically about diabetes, earlier people used to say it is hereditary. For a long, long time, it was a kind of a hereditary, illness. But now this has become a lifestyle. It's become a condition. Every third person, fourth person in the family or in friend circle, we see they are diabetic, and at a very early age. I've seen people getting diabetes at late 30s, early 40s, which was not earlier this kind of approach. So of course it is with something to do with stress levels, with your diet, and what are the factors you think? Let's start with the first question, which can bring diabetes or create a diabetic condition in a person's body. Can you just give an explanation? Then we'll go on to the next question.
right. Yes, yes. First, see about diabetes. What is diabetes? So, it is a lifestyle disorders or disease in which body's ability to produce or response to insulin is decreased. So, insulin resistance will be there, or low production of insulin will be there, which will resulting in abnormal metabolism or of carbohydrates, which will ultimately lead to increased blood sugar levels. So, let's see, multiple causes are there behind diabetes. So one is hereditary, of course, but there are other lifestyle factors which are responsible for diabetes, like insulin resistance or overweight, obesity. I have mentioned before also. So in condition of obesity or overweight, there will be increased insulin resistance that will lead to diabetes in further. So sedentary lifestyle, low physical activity, high calorie intake of food, then, if you are having pre-diabetic, you are more prone to get diabetes mellitus. Then, age factors are also involved. In old ages, nowadays we are seeing in middle 30s also people are getting diabetes due to lifestyle changes. So, diet is very important factor. Then, family history. In your family, if somebody is having diabetes, again same genetic factor, you are more prone to get diabetes. and high triglycerides. So in case of obesity or overweight also you will be having triglycerides high. So that factor is also responsible for getting diabetes. And also stress levels. So I have mentioned before there is a relation between your psychology and your gut brain axis, we call it as. So if you are having high stress level, that will definitely affect on your gut health. And if your gut health is not proper, it is going to convert into diabetes. So those are some factors.
Great. So I'll just like to interrupt to our viewers. If anyone wants to ask any questions in middle of the session, there is a comment box in on Facebook and YouTube as well. You can just type it. We'll try to address the question, and we'll request Dr. Dhyaneshwari to address those. So we'll continue with the next question under the diabetes section. So my next question is, uh, once a person is diabetic, there are two types of diabetes: type A and type 1 and type 2, right?
True. Yes, yes.
So mostly people have type 2 diabetes, which I know. But yeah, so there is no certain treatment to diabetes. So when you go to, say, suppose 3 or 4 different diabetologists or any doctors for the treatment, everybody has a different. They give you different types of medicines, and people do say that if you continue with those medicines for a longer time, maybe 2 years, 3 years, or 1 year, depending on the person's individual metabolism and body, the medicine stops performing because body gets used to that kind of medicine, and again your sugar levels go high. So how frequent, the question one is, how frequently you should do your checkups if you're a diabetic? Secondly, what kind of specific doctors or what kind of medical assistance you should look for?
Okay. So, first, diabetes is individual is having different cause or different factors which are responsible for developing diabetes. So, first we have to take detailed case history. So, what are the factors which are responsible for that particular person? So, we have to manage first cause, then we can go for management thing. So, first, lifestyle management is very important in diabetes condition. So, I will not tell that we can cure diabetes totally, but yeah, with lifestyle modification and naturopathy and yoga, we can manage diabetes. That we can say. And first is that your lifestyle management. In that, your dietary management is important. Dietary changes is important. Then exercise modification is important. So with the help of diet and exercise, we can manage diabetes on certain level. And for further guidance, of course, you have to take particular opinion from particular doctor for your personal diagnosis. So each individual is different. Each have some different history of diabetes or different factors which are responsible for that particular condition. So we have to manage that first. Then appropriate self monitoring is very important. So regular blood checkup is very important. At least HbA1c we can check in every 3 months for monitoring your blood glucose level. Then if you are have or you are on under medication, and along with that you are following diet or exercises, then regular monitoring of your blood glucose level is very important. Then regular checkup, laboratory checkup is very important. So along with these things, we can go further. Along with guidance, we can go further for dietary management and exercise management.
Great. And my last question on diabetes is, what are the side effects of diabetes? People say that your organs, multiple body organs, they
Right.
stop performing because of diabetes. So how does that affect so many organs? Some people, they start losing the sight. Some people have kidney issues. Some have liver issues, and they say that diabetes, keeps damaging your other organs of the body. So
Right.
how does it happen now? This condition is so dreadful to the entire body. This is my last question on diabetes. Thank
Right. So, if our blood glucose levels are increased, that is going to damage your cell level. So, monitoring your blood glucose level is very important. So, high blood glucose level will definitely damage different organs, as edema can be happen. So, excessive water accumulation can be happen in your legs. So, multiple neurological factors are also involved. Neurological conditions like sciatica or any your back pain. Simple back pain can be happen due to diabetes. Kidney failures can happen. Your eyesight will be damaged, or it will be impaired due to diabetes. So there are multiple factors. We can't say in particular person it same thing will happen for everyone, but there are multiple things which can be lead due to diabetes, high glucose levels.
That is very insightful, and maybe we can learn more in future from you regarding the same. So, as I
Correct.
mentioned to the viewers, that if you have any questions, you can type in the comment box. Now, I'll again invite Dada Dayal Arjani to take over the next topic, please. Thank you.
So my questions, Dr. Ji, what
Yes.
kind of therapy would you advise for diabetes? You have not mentioned that.
Okay. Yeah.
Or
So
yoga
first we
exercise.
will talk about nutrition. Nutrition. So low glycemic index food. So glycemic index is nothing but how much carbohydrates you are taking and how much it is going to absorb in your body. That is depend upon the glycemic index of that particular food. So food which is low in glycemic index, those are good for diabetic people. Like for example, apple, avocado, then kiwi, orange. This kind of food are low in glycemic index. So it will not give a spike to your sugar levels. So you can consume that. Include fiber-rich food. So fibers are very important to manage your glucose spike. So it will not cause a glucose spike. Then low calorie diet. Again, artificial sugar or refined sugar we have to avoid. Then take small and frequent meals. So to avoid glucose spike of after each meal, you have to take small quantities in multiple meals. So frequent meals can be taken in small amount. Then protein intake should be more. So these are some dietary factors we have to consider during diabetes management.
One question. So how does this intermittent fasting come
Yes.
in for diabetes? How does it reflect, or how does it? What's the
So
connection?
So that will help, definitely help in diabetes condition. So we are going to take low calorie food throughout the day, and there should be gap between two meals, at least 16 to 12 hours. So that will again help for detoxification, and your body will rejuvenate. So if you are not giving any kind of work, or digestive system is taking rest, so body will heal by itself. So that is important factors, and inflammation will be reduced in our body. So diabetes causes inflammation, and in fasting therapy, it will help to reduce our inflammation in our body. So that
So
will
what you
definitely help in diabetes condition.
so would you're recommending multiple meals in a day? So which is
Yes,
better of the two? Intermittent fasting, which means two meals a
yes.
day, or multi
No,
multi meals a day?
intermittent intermittent fasting is not about 2 meals a day. It is gap between two meals should be 16 hours. If you are taking you are having 8 hours of window for eating. So from morning 7 o'clock till night 6 o'clock or 7 o'clock, you are eating food. So in between that, you can take frequent and small meals. And
Okay,
from again 12 hours of fasting and 12 hours of food intake you can do. From
okay,
7 at night till the 7 in the morning, you can go for fasting. So that is the thing.
that makes sense. Okay, thank you.
Yeah.
Okay, so
So
now
there are
exercise. Yeah, what
yes.
else?
Yeah, nutrition. I will talk a few things more. Then we have to give chromium-rich food. So chromium is it keeps your blood sugar level in balance. So chromium is present in green leafy vegetables, then almonds, cashew nuts. These foods are containing chromium. So we can take that in our diet. Then bitter gourd juice is very helpful for diabetes. So, it contains substance P, which is natural insulin. So that will be also helpful in diabetes condition. Not every day, but thrice or twice in a week, we can consume bitter gourd juices. Or omega-3 fatty acids, I have mentioned before also. It is anti-inflammatory in nature, so we can include flax seeds and chia seeds in our diet also. And there are few herbs like fenugreek seeds. Fenugreek seeds is high in soluble fibers, which will help to lower your uh, release of glucose. So it will regulate the blood glucose level. So fenugreek seeds can be taken. Then cinnamon tea can be taken. It is also helpful for maintaining your maintaining your blood glucose level. Turmeric can be taken. It is also again anti-inflammatory in nature, antibiotics, or it is very helpful for regulating your inflammation or reducing your inflammation. So these are few things we can include in our diet.
Mm. Okay.
So next, see about yoga therapy. We will see about yoga therapy. We can present the slides for diabetes now. So, sun salutation, as I have mentioned before, that is also helpful in managing diabetes. It is
Mm.
going to improve your digestion and metabolism. And there are few asanas I have mentioned in slides, so we can see that. Can we present the slides? Yes. So, Ardha Chakrasana or half wheel pose, it is going to stretch your abdominal muscles and it is going to burn your excessive fat in that particular area. So, we can practice this asana. Next asana is Trikonasana. Next slide we can see. So, triangle pose or Trikonasana, it is going to again, we are focusing on our abdominal area. So, this exercises or these asanas are going to help to stimulate your pancreas and more insulin secretion will be there due to practice of this asana. So, next asana is Pavana Muktasana. Next slide we can see. Can we change the slide? Next slide. So, yes. So, this is also called as wind releasing pose. So, we are giving pressure on our abdomen. So, it will going to stimulate our pancreas and also stimulate our digestive system. And it is also beneficial for all the digestive disorders like constipation and indigestion or gastritis. In this condition, also we can practice this Pavanamuktasana. So, next asana is Dhanurasana. Next slide we can see. Again, this asana will again going to stimulate our pancreas, also beneficial for respiratory conditions. And practicing this asana along with breathing, it is going to increase our respiratory capacity also. So, along with diabetes, it is beneficial for other respiratory conditions also. And next, last practice we can see is Ardha Matsyendrasana. Next slide we can see. So Ardha Matsyendrasana is a twisting posture. Yes. So again, it is going to develop a pressure on your abdomen and excessive fat will be like fat mobilization will be there. Again, digestion will be improved and stimulation of your pancreas for release of insulin will be there. So that's about yoga therapy. We can shut down the slides. There are few pranayamas like right nostril breathing, which is called as Surya Nadi pranayama. So inhaling and exhaling through the right nostril, that is having effect on your sympathetic nervous system. So it will ultimately improve our metabolism. So that is also very beneficial for diabetes condition. And last, Nadi Shuddhi pranayama or both the nostril breathing that is going to help to balance your sympathetic and parasympathetic nervous system and it will give your stress levels will be down. It will manage your stress levels. So that is very important practice. And last, we have to end our practice with deep relaxation technique or any Omkara chanting or Yoga Nidra practice that will also help to reduce our stress levels. So there is, we can see on slides, so cold abdominal pack it is. So it comes under hydrotherapy. So first, the procedure of this pack is we have to dip our cotton cloth in cold water or neutral water and rinse it, remove excessive water and apply it around the abdomen. So you can wrap it again a second layer with woolen clothes. So it will help to maintain the temperature within that area. So this abdominal pack will help to stimulate your blood circulation, stimulate your digestive system, and improves the blood circulation in that particular area. So insulin stimulation will be more, pancreas stimulation will be more, and insulin production will be more. So it is very good practice for diabetes condition. Next slide we can see. Again, abdominal mud pack. So direct application can be done. Otherwise, mud pack. We have to keep mud in cotton cloth and we can apply that cotton pack, mud pack on our abdomen. So again, same benefits. It will improve the blood circulation in that particular area. So vasodilation will be there, and blood circulation will be improved, and digestion will be improved. So only not only for diabetes, for constipation, indigestion, gastritis, hyperacidity, also this mud pack will be beneficial. Next slide we can see.
Okay. So
So that's it about diabetes.
shall we come to this topic?
Right, sure.
Can you explain to the viewers what really is hypothyroidism and how does it affect and what are the symptoms and then how do we
Right,
address it?
sure. So hypothyroidism is underfunctioning of our thyroid gland. So there will be less secretion of thyroid hormones. So the multiple causes are responsible. So autoimmune diseases like Hashimoto's disease is one of the cause for hypothyroidism. So iodine deficiency can cause hypothyroidism, inflammation of the thyroid gland. So it will lead to decreased production of thyroid hormones. That is the one of the cause for hypothyroidism. And of course, stress factors. High levels of stress can cause hypothyroidism. So these are few things which can be considered as a cause for hypothyroidism. And there are multiple symptoms like in hypothyroidism, multiple symptoms like increased weight, then cold sensitivity will be there, constipation will be there, then pigmentation of the skin, then fatigue will be there, and excessive amount of weight gain will be seen in hypothyroidism condition. So these are some lifestyle disorders. So violation of nature's law, or we are going against nature's law. That is important factor to consider for understanding the hypothyroidism condition. So if we are violating nature's law, wrong dietary habits, inadequate physical activity, high stress levels, so these are going to convert into improper blood and lymph formation. So that will lead to hypothyroidism or imbalance in your hormonal levels. Also, it can cause PCOD or PCOS, which is we are going to talk about it later. So those are a few factors to consider during managing hypothyroidism.
That's
Can we go for management part? So again, fasting therapy is very beneficial for controlling hypothyroidism. So short-term fasting we can do. We have introduced with intermittent fasting and juice fasting. Short-term fasting is one of the type of fasting in which we can go for 3 days or 2 days of complete water fasting, complete abstinence of food. So how to prepare for that? First day we have to take boiled diet, boiled vegetables or rice, chapati we can take. Second day we can go for only fruit fasting, only fruit consumption throughout the day. Third day, we can go for only juice diet. So throughout the day, we can consume any one type of juice or any fruit juices or vegetable juices. And from fourth day, we can go for actual fasting, which is only water fasting. So we are not going to take any kind of food during that particular period of time. We can go for 1 day, 2 or 3 days of complete fasting. And again, we are coming back to normal diet with reverse order. So we have to end our fast with juice diet, fruit diet, and again next day we can go for boiled diet. So this type of fasting is very beneficial to detoxify our body. And yes, then we can go for nutrition factor. So natural probiotics, as I have mentioned before, we can go for probiotics consumption. Then coconut oil can be taken, or we can add this into our food or regular meals. So it is anti-inflammatory. in nature, then iodine rich food should be included. So iodine deficiency is one of the cause for hypothyroidism. So iodine intake should be done on regular basis. So that is important. And antioxidant rich food should be taken. Also low calorie intake should be done. So those are a few dietary factors which have to be considered during hypothyroidism management.
One
And
question.
there are, yes,
What
yes.
is the main symptom of hypothyroidism? What is the main symptom?
Hypothyroidism, that is, weight gain can be seen in hypothyroidism, cold sensitivity. So person will be more sensitive towards cold temperature. That is major symptom we can see.
So it's directly related to overweight or obesity, is it?
Yes, yes.
Anything else besides that?
There are multiple factors we can see in different people. So facial hair growth can be seen, or disturbance in your menstrual cycle can be seen. So depend on the individual, or they are having any combined condition, other condition along with hypothyroidism. There will be multiple different symptoms can be seen. So main symptom is overweight or weight gain. Sudden weight gain will be there during hypothyroidism condition.
Okay, so then the best exercise is Sarvangasana? Sarvangasana is the
Yeah,
best? Or no?
Sarvangasana is very beneficial for hypothyroidism. So
Hmm.
first, we will see some foods we have to avoid in hypothyroidism.
Okay.
So like processed food, excessive sugar intake should be avoided. Then goitrogenic food, goitrogenic food in the sense broccoli, cabbages, or radish, cauliflower. These food are rich in goitrogenic food. We can call it as. So those food are responsible for hormonal imbalance. So we can avoid those food in this particular condition. Otherwise, we can have those foods, but in hypothyroidism condition, this food should be avoided. Then bakery products, maida products, alcohol, these things should be avoided during this condition. So we can go for yoga therapy. We can start with the neck exercises first. So rotation of the neck, forward and backward bending. Those things we can do as a loosening exercises or as a warm up. And sun salutation, of course, it will be beneficial for this condition also. And few asanas I have mentioned, we can see in the slide also. So Sarvangasana or Halasana, we can present slides. In Sarvangasana or Halasana, so it gives pressure on our neck. So direct stimulation of our thyroid gland will be done. So it helps to increase the blood circulation in that particular area due to gravity and due to increase the pressure on our neck. There will be stimulation of our thyroid gland. So it is beneficial for hypothyroidism. Then excessive. Then Matsyasana. Next slide we can see. Yes. Matsyasana we can practice. Again, it is creating a pressure on our neck or thyroid gland. It will help to stimulate our thyroid gland. And there will be proper secretion of thyroid hormones like T3, T4, and calcitonin. These hormones will be secreted properly due to practicing these asanas regularly. Next practice is Setu Bandhasana. Next slide we can see. So Sarvangasana, Halasana we have seen. Next we can see Matsyasana or Setu Bandhasana and Bhujangasana. So this is Matsyasana. Again we are stretching our neck. Again those muscles will be contracted and released. So it improves the blood circulation in that area again. Next asana is Setu Bandhasana. Again, this we are practicing chin lock in this. So in this asanas, we are inserting our chin on our throat region. So direct pressure will be developed on our throat, and it will help to stimulate our thyroid gland. Next is Bhujangasana. Again, this practice will be also helpful for thyroid stimulation. And at the end, we can practice relaxation technique. After practicing these asanas, we can go for relaxation techniques like deep relaxation techniques. and it will help to reduce our stress levels. It will stimulate our parasympathetic nervous system, which will help to reduce our stress level and calm down our mind. And few pranayamas are there, like Brahmari pranayama. So this pranayama will we have to close our ears with fingers, both the index fingers. We have to inhale through the nose, and while exhaling through the nose, we have to make makara or humming bee sound. So that is those sound vibrations are helpful for stimulating our head and neck region. Also, it will help to dilate the blood vessels due to increased nitric oxide in our blood, so that is good for hypertension also and thyroid functioning also. And
There's
at the end, Akara chanting. Yes,
You mentioned something about nitric oxide.
yes, yes,
Can you repeat that?
yes. So
Yes.
Brahmari pranayama, as I have mentioned, inhaling through the nose and exhaling through the nose. And while exhaling, we have to make humming bee sound. We have to close our ears and make a humming bee sound. That is going to create some vibrations. Those the researchers has been done. It shows that it will help to increase the nitric oxide. So that will ultimately help to dilate our blood vessels, which will improve the blood circulation and reduces the blood pressure also. So it is good practice for hypertensive people, people with high blood pressure also, and for thyroid functioning also. And last we can see Akara chanting. Akara chanting also, the vibrations of that sound, it's going to stimulate our thyroid gland. So that is very beneficial for thyroid stimulation. And in hydrotherapy, as we have seen in slide, so there is a throat pack. Again, we have to dip a cotton cloth in normal water or cold water we can take and wrap it around your neck. Again, the thermal receptors in our body are going to work, and it will help to dilate our blood vessels, and it increases the blood circulation in that local area. So thyroid gland stimulation will be there.
Can we ask
Uh,
Vishal now to talk to you on PCOD? Vishal,
yes, yes, yes.
Vishal, can you come in?
There is a one thing I would like to mention for hypothyroidism. So, vitamin D deficiency is very common in hypothyroidism because calcium metabolism will be altered. For calcium metabolism, regulating calcium metabolism, we need vitamin D. So, everyday sun bath is very necessary for hypothyroidism people. So, at least 20 minutes of sun bath in the morning, early in the morning, is very important to manage this condition. Yes.
Okay. Vishal,
Yeah, so
go ahead.
thank you so much. It was very insightful. The best part is you are identifying the symptoms, and we are discussing about the disease and also about the cure. So, whatever asanas you have shown are really very helpful. I've used some of them in the past. Now, we have the last
Okay.
focus topic of the day is PCOD, which is also very much talked about in these days in all the families. So, what exactly, the same question, are the symptoms of PCOD, and what exactly it does? What function does it do in our body and damage? So, what kind of organs, and what is the cure? Thank you.
So PCOD is nothing but polycystic ovarian disease, or if it's present with multiple symptoms, we can call it as polycystic ovarian syndrome. So it is nothing but developing multiple cysts in our ovaries. It is associated with multiple symptoms like facial hair growth will can be seen in this condition. Then pigmentation on our face or any neck region can be seen. Then acne can be seen. Overweight or obesity can be seen. So those are multiple factors along with multiple cysts in ovaries. So there is no particular cause for PCOD, but yeah, there are multiple factors which are responsible for hormonal imbalance, which are high stress levels like insulin resistance. In obesity also can lead to PCOD. So those are like lifestyle, wrong lifestyle also can be lead to PCOD. So there is no particular cause as such for PCOD, but yeah, there are different factors which can be responsible for this condition. And there are risk factors. If you are not controlling your PCOD condition, it can lead to infertility in further uh, period of time, or it can lead to diabetes because again insulin resistance will be developed in PCOD conditions. So it can lead to diabetes. Heart diseases can be occur. Then endometrial cancer. There is a high risk of endometrial cancer if we are not treating PCOD properly. So depression can be developed due to PCOD. There are multiple risk factors which can be developed due to PCOD. So how to manage this? We can go for management. So main management factor is lifestyle modification. So correcting our sleep wake cycle, which is circadian rhythm, we call it as. So sleep wake cycle is very important to maintain our hormonal regulation. So that should be corrected to manage PCOD. Then correcting our food habits, low calorie intake, high fiber diet, and avoiding all the preservatives or processed food or refined food. So those are very important factors to consider to correct our hormonal balance. And nowadays we are getting all the milk or dairy products. So cows or buffaloes are getting injected with hormonal injections. So we are getting those hormones through the milk in our body, and that is one of the cause for hormonal imbalance. So that factors also should be considered during managing this PCOD condition. Then stress management, of course, it is going to affect on our physical health, mental health. So that is one of the factors. And reduced physical activity. So low physical activity is one of the cause uh, to get PCOD, and we have to manage that to in order to maintain our health. So first we will see about nutrition factors. Again, fasting therapy I will like to include here. So fasting therapy is definitely going to help in this condition. Then we have to include a vegetarian diet again because red meat or multiple eggs. Again, chickens are getting injected with different hormonal injections. That is ultimately going to cause imbalance of hormones in our body also. So those factors should be considered. Then low calorie diet, fiber rich food, fruits and seeds and nuts we have to include in our diet. Whole grains, legumes, beans should be included in our diet. So there is a spearmint herbal tea, particular herbal tea which will help to regulate our hormonal level. So we can consume that also. And there is a practice called seed cycle. So seed cycle is nothing but consuming particular seed in particular duration. So I will elaborate that. So from first day of menstrual cycle till the 40th day of menstrual cycle, we have to consume flax seeds and pumpkin seeds. Each seeds 2 teaspoons. We can have it is in the raw form, or we can make it powder of it, and we can add this seeds powder in our food, and we can consume that. And from 15th day of menstrual cycle till the 30th day of menstrual cycle, we can consume sesame seeds and sunflower seeds. So this seed cycling method is very helpful to balance our hormones, mainly in PCOD condition or PCOS condition. So that is one thing. And again, avoiding processed food, sugar, then preservatives, all the refined food, milk products. It will be again helpful for managing this condition. So yoga therapy we can
Great.
see next. So sun
Yeah.
salutation also we can practice, and there are few asanas we can see in slides. So in these asanas, we are going to focus on our reproductive organs. So lower part of the abdomen will be more focused on during these asana practices. So there are few asanas we can see in the slides, which is Prasarita Padottanasana, which is wide leg forward bending. So this asana will help to develop a pressure on your lower part of the abdomen, and it will help to stimulate our blood reproductive system. Blood flow to the reproductive system will be increased. So that asana will be helpful. Then Baddha Konasana. Can we present the slides? So Baddha Konasana, yes. Next. So this one is first asana, wide leg forward bending. As I have mentioned, it will stimulate our reproductive system. Next asana is Baddha Konasana. Yes. So again, pelvic strengthening exercise. This is for multiple conditions. We can use this mainly for reproductive health. In urinary incontinence, also we can practice this asana. So it is going to help to stimulate our reproductive organs, and blood circulation will be improved in that particular area. So next asana is Chakki Chalanasana, or mill churning pose. So this is rotation of our lower part of the body from hip joint. So it will again help to mobilize our fat in that particular area, also stimulate our reproductive system. So very important practice for menstrual health or reproductive health in condition of infertility or PCOD. Next is Janu Shirshasana. Yes, so we are keeping one leg on another root of another leg. So that is going to and forward bending. Again, we are developing pressure on our lower part of the body, lower part of the abdomen. That is going to stimulate our reproductive organs. Then there are a few pranayamas like Nadi Shuddhi pranayama. Again, this is balancing pranayama. This will help to balance your sympathetic and parasympathetic nervous system. And last pranayama is Brahmari pranayama, as I have mentioned before. That will help to reduce our stress levels, and relaxation can be practiced at the end of the yoga session. That will definitely help to manage our stress levels. And this is hydrotherapy treatment, which is hip bath. So hip bath is nothing but immersing our hip region from up to navel region. Water should be immersed in the tub. We can sit in that tub for 20 minutes. So again, thermal receptors will be activated in that particular area. Vasodilation will be there. It improves the blood circulation. So conditions like dysmenorrhea or pain during menstrual cycle, irregular menstrual cycle, PCOD, PCOS condition, also infertility. In these all conditions, this treatment will be very helpful. There is one more treatment in naturopathy or hydrotherapy, which is called sitz bath. So same tub we can take, and we have to sit in that tub. Just the temperature of the water should be cold. So cold temperature up to navel region, we can immerse our body in that water, and we have to keep our legs into hot bath, or hot foot immersion should be taken. So that will help to balance our body temperature, and cold pack on head. So this treatment again will help to improve the blood circulation in our reproductive system. So it is very beneficial for PCOD or PCOS condition. We can practice this treatment for 20 minutes, and these are very easy treatments. We can practice this at home also. There are specific conditions like during menstrual periods, we should not practice this treatment, or during pregnancy or any urinary tract infection, we can avoid these treatments. Otherwise, we can practice it. And common things to be followed is lifestyle modification, of course, definitely. And then avoiding some processed food, junk food, all those things are very important to manage this condition. Then adequate physical activity, sun bath is very important. Then regulating sleep wake cycle, and mind body relaxation. So those are some things which should be considered to during management of PCOD or PCOS condition. Yes.
Time is up. We'll have to conclude our show. But I have
Yeah.
one interesting question to you, which you made, that we should be avoiding milk and chicken and meat in which they have hormonic injections, and that reflects in
Yes.
our body. Um,
Right.
there are some people who say that if they don't eat meat, they don't get enough proteins. So, how do you balance out this uh,
So we have to
availability of,
make sure this.
and the
Right,
negative impact of this hormonal injection in the animals?
right. So we have to consider the source of that food. We have to check for that first. So if it is organic meat or organic milk, so we can go for that diet also. But these problems are generating nowadays because of hormonal injections. So we have to consider that part also, and we can switch to vegetarian diet also. We can try vegetarian sources of protein also, like legumes or dals. Many kinds
Mm.
of dals are there, so we can consume that also for protein.
Meat eaters are, they are so saturated in their thinking process that they would not like to
Right, right.
shift to a vegetarian diet,
No,
But Vishal
I
is
will
a
not
vegetarian.
tell that to switch directly, but yeah, you have to check the source of your food. So you can take measurement, like we can check on that also. If you are able to control in particular, like we can control the that source of food, so we can go for that also.
Okay, so my last question now, before I ask Vishal to end the show. And Vishal, you got your prayer ready or no?
Yes, yes, ready now. Yeah.
Okay, I just want to discuss about the uric acid problem. Some of my friends have got uric acid, and what is your guidance to them?
So mainly for uric acid, we have to avoid purine-rich food, which is rich in purine. So purine is compound which will be break down in uric acid. So if you are having high uric acid level, some food like fish, high fat foods, then dairy products, red meats, these products are high in purine. So we can avoid this food for particular period of time until and unless we can get back to normal condition. And again, alcohol consumption should be avoided during that period. And high vitamin C rich food we can take and high fiber diet should be taken during that period. So these are some dietary management should be considered for managing high uric acid levels.
Very good. It has been really an enlightening and educational and a learning experience for all of us. Thank you very much for having graced our show. And we hope to be in touch with you more often.
Sure.
And with our thanks once again, I'll ask Vishal to conclude the show with a small prayer.
Sure. Thank you. It was very insightful, and I'm sure all our viewers would be very happy, and it will help them for a lot of curing a lot of diseases and help their family and friends as well. So
I
I'll
think
end
we'll have to
this
play
show.
this on slow motion. Vishal? We'll have to play
Sorry.
this in slow motion for
Yeah, yeah.
everybody to imbibe all her
Correct,
information that
correct.
she has passed on to us.
Especially the asanas specific to the disease was really my takeaway from this show. I'm really humbled the way you have, answered all the questions, and we're very, very happy. So I'll end this show now with
Thank
the
you so
permission
much.
of everyone. So there's a small prayer. हे ईश्वर, सबको सम्मति दो, आरोग्य दो, सबको सुख दो, आनंद और ऐश्वर्य दो, सबका भला करो, कल्याण करो, रक्षण करो, और तेरा मीठा नाम मुख में निरंतर रहने दो. जय श्री
Yes,
कृष्ण.
Sri Ram.
Jai
Thank
Shri
you,
Ram.
Thank you very much.
Vishal.
Thank
Thank you
you.
very
Thank you
much.
so much.
Thank you,
Thank you so much.
Dr. Dhaneshwari. God bless you, and you. I hope you have a successful future ahead of you. And
Thank you so much.
you can send us your brochure, and we can recommend people in Hong Kong and Singapore and Far East to take your
Sure.
online course. Okay.
Sure, sir.
Thank you.
Thank you
Thank
so
you.
much.
Thank you.
Thank you.